Permanent Auditory Impairment Health Concerns by Kirsten Tesh. Profile Description of the population. The vulnerable population of choice is permanent auditory impairment. This population experiences more social, public, and economic challenges compared to those without impaired hearing. Although many advancements have been made to make sure this population has sufficient assistance, there is still room for improvement. Profile. Size of population. There are approximately 600,000 people in Utah who have a hearing impairment. The National Institute of Deafness and Other Communication Disorders explains that about 15% of U.S. adults 18 and older have reported they have hearing loss. The World Health Organization states that there are about 466 million people worldwide who have a disabling hearing loss. I was unable to find any state-related or locally related numbers for impaired hearing in the Ogden area. Contributing factors. Social determinants of health. Many social determinants of health could present a barrier for the population. For example, economically, this population is challenged because unemployment and underemployment affect them. Robin Carell mentioned that 8% of the working-aged adults who have hearing impairment were looking for work but still unemployed in 2018. Healthcare access and quality also impacts this population due to the fact that many receive healthcare through their employers. This goes hand in hand with unemployment. If this population is unable to find work because of their disability, many go uninsured. And a lot do not get hearing aids because they don't have insurance, or even the cochlear implants that are have shown to be effective with this population. Social challenges arise with this vulnerable population as well. Hearing impairment does not target a specific age, race, or gender. Many communicate by using sign language, writing things down, or reading lips. Not being able to communicate effectively or appropriately can negatively affect their relationships and can result in social isolation, which can have a negative impact on their mental and physical health. I see this with my grandma, who's also hard of hearing. She has Meniere's disease, and she has lost complete hearing in her left ear due to a surgery that she had and to fix the Meniere disease, and they said that it would only happen in one ear, and there was like a 20% chance that she would not get it in the other, and she actually ended up getting it in the other ear. So every Meniere attack that she had, she gets more hard of hearing as those attacks happen. So she has a hearing aid that is in her other ear as well, and she's at parties and stuff. You can tell she has a hard time because she can't really hear what's going on, and when she's home, she just reads and sits in her chair and just kind of has a hard time that way. So I can see that definitely having an impact with this population. Contributing factors, the root cause. Many hearing impaired people are often taken advantage of because they cannot hear. Whether they were born with the hearing impairment or have acquired it due to age or environment, they can experience the same health outcomes if they become socially isolated. And I also see this with my grandma. She, a lot of times people will call her and she can't hear, so she ends up just doing what they've asked, or thinks that they said something, so she just says okay. And I've just noticed a lot of people try to take advantage of her, whether we're out and about or if it's over the phone. Contributing factors, Maslow's hierarchy of needs. Many physiological aspects of Maslow's is met for most of this population, but this population might have a loving and supportive family and have even made friends with the same conditions, but the connections might be lacking due to poor communication. This population could lack employment, resources, and health relating to their condition, self-esteem, confidence, respect of others, and could have unmet self-actualization needs because the others have yet to be met. The anticipated functional level for this population would be physiological. Health outcomes for this population is probably low because they lack many needs that a human being has to achieve. Specific concerns. communicable and non-communicable diseases or infections. The hearing impaired population is not at a higher risk for communicable diseases or infections when compared to the rest of the population, but they do have higher rates of health problems compared to those without. According to a study by Frank Lynn, a Johns Hopkins expert, those with severe hearing impairment had a 5 times more likely chance to develop dementia. Your hearing plays a role with balance, and when you walk, your ears pick up cues. A person with hearing impairment does not sense these cues and can interfere with how they process walking safely. I've also seen this with my grandma. They took her, I think they took out her nerve in her ear, in her inner ear, and when she has an attack, her complete left side is not even usable because she does not have balance on that side, and then her balance on her right is barely there because she can't hear as well. But studies have been shown, or have not been done, to see if the hearing aids could decrease these risks, but it's in the planning stages. Specific concerns: self-care, self-harm. Social isolation is a concern for this vulnerable population because they are unable to communicate effectively and appropriately with those around them. The hearing impaired does not have much contact with others and lack the sense of belonging. All of this can increase this population to have poor eating habits, smoking and alcohol use, depression, dementia, lack of exercise or self-care, poor sleeping patterns, and heart disease. Education is huge when it comes to mitigating these concerns. There are many resources that the population can reach out to have a positive outlook on life. Specific concerns: risk for harm by or to others. According to the Oxford University Press, deaf children have a higher rate of aggression, noncompliance, and inattention when compared to their hearing peers. The hearing impaired population has been shown to be more susceptible to physical, emotional, sexual abuse, and neglect. And these are my references. I know one of them is from 2013, but I feel like it applied, so I added it. Thank you.